Okay, so now we'll talk about another concept in biomechanics, that is ground reaction forces. Okay, so basically, ground reaction forces, as the name implies, that this is a force that is coming from the ground, and it is a reactionary, it is a reaction force. Okay, so this is a reaction of the force that you are applying to the ground. Okay, so for example, here you can see that this person is getting ready to jump and they are applying a certain force on the ground, and the ground is basically emitting the same force and providing the same reaction force. We'll discuss this, that why is that important, why is that important for us to discuss this. Okay, the important thing is that this is basically Newton's third law. Okay, Newton's third law, that action and reactions are equal to each other but opposite in equal in magnitude but opposite in direction. Okay, so that is basically what you see here ground reaction force as. So ground reaction force is basically always captured through a force plate. Okay, I hope you guys know what is a force plate. So force plate is an instrument that is put on the ground or embedded in the ground that has load cells in it that basically would give you the amount of force that you're applying on it, and then it would give you the idea of how much force is getting out of the ground. Okay, so this basically cannot be measured without a force plate, so you need to have a force plate for a ground reaction force. This force is calculated in biomechanics through inverse dynamics. Okay, so what is dynamics? Dynamics is a study of forces and their effects on motion. Okay, so basically you have forces and you are studying their effects on motion. Okay, that's your Newton's second law of motion. If you have a force and you have a constant mass, then F is directly proportional to A, and A is your acceleration. The amount of acceleration the motion produced is directly proportional to F. So dynamics is basically having the forces and then calculating the motion out of it. Inverse dynamics is that you have the motion, basically you have the kinematics, and you draw, or draw the inferences of forces out of that motion. Okay, so there are special equations that are very lengthy and beyond the scope of this text or our practice, inverse that describe the process through which these forces are calculated. So this is the brief about the physics of the inverse ground reaction forces. Okay, so I'll give you some examples in the body for the ground reaction forces. Here we have some here, and that would give you some of the application of this ground reaction forces. So let's assume, let's stand up on your bilateral feet. Once you stand up on your bilateral feet, and if you are equally distributing the weight on both of your legs, then you have an equivalent amount of ground reaction force coming out of the ground with respect to your weight. Okay, and um, this force can increase when you are about to jump, like in this person, when he's about to jump, he's putting extra force or pressure on the ground, and the ground is emitting um, a ground action force that is of a higher magnitude. Clinically, this is also important because this surface here, that is your ground surface here, for example, this one, this surface is also of clinical significance. I'll give you an example. Think about running on a concrete versus running on a ground of that has grass on it, or just a ground, it's just a mud ground. There are differences between the two. Concrete would provide you with exactly the same amount of reaction forces that you are putting in it, so everything comes back. But if the ground is made up of mud, or if it's a grass, then there would be absorption of these forces. Okay, so that basically tells you that if there is an absorption of the forces, then there are less forces that are coming out of the ground. Okay, if there are less forces coming out of the ground, then you are at lesser risk of injury. You are at a more risk of injury when you are walking or running over a concrete, because everything would come out. Okay, so that is the importance of the ground reaction forces when it comes to sports medicine physical therapy or sports physical therapy, that a lot of times when you see the injury in patients, and you ask them the surface that they are running, then those injuries can be related to the surface that they are running. So you, by just modifying the surface, or advising them a different surface, you can actually take care of their problem. Okay, now let's look at some of the other aspects of the ground reaction forces. So for example, look at this person here. This person is jump landing. They started from here and they're landing here, starting from here, landing here. So we have two different types of landing that they have done here. The first one you can see here that, first one, their back is not that bent. And then you can see that, the moment arm from the knee joint is much higher than that of the moment arm that they have at their hip. Okay, so that basically shows that they have an uneven distribution of moment arm here. Okay, so that uneven distribution of the moment arm here basically is telling us that they are putting more pressure on their ACL. Let's say for example they are recovering from their ACL, and if they don't have good biomechanics, and they're landing in a faulty posture, then that they can further injure their ACL ligament. Okay, because there is an uneven distribution of forces here. This is the ground action force here that you can see that is visible here. That is the ground action force here. Similarly, we can see that if we improve their landing mechanics, if they are bending their back, and just by bending their back, they're more evenly distributing their forces between their hip and knee. And this even distribution, provides a protective effect on ACL by not straining the ACL. Okay, so that decreases the strain on ACL. Okay, so this is just a basic example of the ground reaction force here. This is a very important concept, and this concept requires a lot of time, but I'm gonna give you a very brief summary of it, and you'll learn more about this in your GATE class. Okay, so basically we might go a little over 10 minutes for our this content here. So basically this arrow here represents the ground reaction force. We'll just look at the foot for the simplicity of this class here. So this is your ground reaction force, and this basically shows you that how it changes in the different phases of the gait. Like for example, you start in the initial contact. This is your joint axis of rotation, and this is your ground action force. Okay, so for torque, we'll use the word moment. Okay, torque and moment are the same words in biomechanics when they are used. I'm not talking about the moment arm. I'm talking about torque and moment, not the moment arm. Okay, moment and torque are the same words. Basically when we say moment, that's when we are describing the torque. So when the ground reaction force is posterior to your ankle joint, okay, then it produces a torque there, which I'll call moment. That is external, since it is coming from a force that is outside of the body, ground reaction force, external. And this ground reaction force is posterior to your ankle joint. If it's posterior to the ankle joint, then it would pull this ankle backwards. If this will pull this ankle backwards, then this ankle needs to go down. It's pushing it down. So pushing your ankle or your foot down, like on a gas pedal, is called plantar flexion. Okay, so this ground action force here on the posterior side of the ankle is producing external plantar flexor moment. Okay, so this external plantar flexor moment would be counteracted by your internal moment, and that would be produced by your dorsiflexors. Okay, and that would be called internal dorsiflexor moment. Okay, they both are equals to each other, so that's why, like, this position is maintained. If one of them becomes bigger than the other one, then you lose that position, and basically what happens is that your foot goes into that direction. When you have a dorsiflexion weakness, okay, and you're not able to produce the internal dorsiflexion moment, then you get into this condition of foot slap. Your foot would slap on the ground because this moment would take the lead in that, and it would overcome your body mechanics and it would slap the foot on the ground. So that's the practical example of, clinical example of that foot slap that you have learned in your different classes, that why is it happening. This is the physical example, physics of your foot slap. Similarly, if you go forward, here also your ground reaction force is posterior to the ankle joint, and your moment is external plantar flexor moment. Here your ground reaction force moves interiorly, so you have an external dorsiflexor moment. Okay, and then again here you have an external dorsiflexor moment. This is also external dorsiflexor moment, and this is also external dorsiflexor moment. To all of these moments, when it is external dorsiflexor moment, they are counteracted by internal plantar flexor moment. Okay, so this is the brief concept of how the ground reaction forces are acting on the joints in the body. I'm happy to explain this again. I'm happy to talk about the comments or the questions that you have in the comment section. Okay, again, discuss with each other, put your comments in there, and let's have a discussion on this. If you have any problems here, the same principle that I have described here would be followed by the ankle, by the hip joint, and by the knee joint. So by this, by just looking at this ground reaction force, you're easily able to tell which moments are produced at what joint and how they are counteracted. This is the example, graphical example of your ground reaction force during the gait, and you can see that at the initial contact, and at the first couple of phases of your gait, you see that the ground reaction forces are higher. In the mid stance, this ground reaction force becomes lesser, because it is sort of a time where you have a lot of forces absorption is going on in the mid stance here. Okay, and then again at the toe off phase, you are basically again seeing the increase of the thrust on the ground, that you're putting in, hence you're getting more ground reaction forces. This is at your ankle joint that you can observe here. Okay, so this is the basic principle of ground reaction forces. When we talk about ground reaction forces, one thing I would like to mention here, that we are talking about vertical ground reaction forces for the simplicity here, but there are anteroposterior ground reaction forces, there are mediolateral ground reaction forces. They are not as commonly studied as we do for the vertical ground reaction force. That's why I would stick to the vertical ground reaction force for our content here. Thank you very much. If you have any questions, put them in the comment section.